Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: what are mushrooms drug? The mushroom drug, commonly known as magic mushrooms, or shrooms, is a slang term for mushrooms containing psilocybin and psilocin, a psychoactive drug or substances that cause visual and auditory hallucinations. People may eat shrooms or brew them in tea to get high. When one eats mushrooms drug, the psilocybin in them breaks down into the active ingredient called psilocin. Psilocin acts as a blocking agent. In this case, it prevents the reuptake of the serotonin neurotransmitter. As a result, psilocin can bind and stimulate the receptors in the brain. This triggered the so-called shroom trip. How long do shrooms last? Mushrooms drug will stay in one system for about 15 hours on average. There are about 40 different species of psychoactive mushrooms, with most of them found in the United States, Central America, and Mexico. Although they have historically been used for medicinal purposes and spiritual rituals, they are widely abused today for their psychedelic effects alongside other hallucinogen drugs like ecstasy and LSD. They are also frequently abused at music festival events. Consuming shrooms can create an intense user experience with quick and long-lasting effects. Most users begin to feel the euphoric effects of mushrooms drug within 30 minutes of taking them, lasting for about 6 hours. However, some users may continue to feel the side effects for days after taking the mushrooms drug. The psychological consequences of using these drugs include hallucinations and an inability to discern reality from fantasy. Psychotic-like episodes and panic reactions also may occur, particularly if a user ingests a high dose. Mushroom drug classification. Psilocybin is a Schedule I substance under the Controlled Substances Act, meaning that it has a high potential for abuse. No currently accepted medical use in treatment in the United States, and a lack of accepted safety for use under medical supervision. In an evaluation of the safety and abuse research on the drug in hallucinogenic mushrooms, Johns Hopkins researchers suggest that if it clears Phase 3 clinical trials, psilocybin should be recategorized from a Schedule I drug, one with no known medical potential, to a Schedule IV drug such as prescription sleep aids, but with tighter control. Following the Controlled Substances Act of 1970, any drug with the potential for abuse is categorized based on criteria that consider whether the drug has accepted medical use, its safety, and the potential for abuse. Although preliminary research studies suggest that psilocybin may be effective for smoking cessation and disorders such as cancer-specific depression and anxiety, it must clear Phase 3 clinical trials before the Food and Drug Administration can be petitioned to reclassify it. Although psilocybin, the substance that causes hallucinations in mushrooms drug, is relatively less harmful than other drugs and not prone to compulsive abuse, the researchers don't recommend releasing psilocybin into patients' hands even with a prescription. They believe that the conditions should be tightly controlled and that when taken for a clinical reason, it should be administered in a healthcare setting and monitored by a person trained for that situation. What are mushroom drug slang? There are over 200 species of mushroom that contain psychedelic chemicals, including 180 that specifically have psilocybin or psilocin. Each one has its own unique Latin name. Mycologists, a scientist studying different types of fungi, use Latin to name and categorize different mushrooms. For example, the scientific name for the most common mushrooms drug is Psilocybe cubensis. This particular mushroom belongs to the genus Psilocybe, the genus which includes the greatest amount of psychedelic mushrooms. The term cubensis indicates the exact species. At least 245 distinct species are in the Psilocybe genus, and not all contain the psychedelic compound psilocybin. Yet, no matter the species, all psychedelic mushrooms are lumped together under the magic mushrooms umbrella in Western popular culture. But what are shrooms slang other than magic shrooms? Certainly, this is not the only slang term for these psychedelic fungi. How it looks, tastes and smells. Many poisonous mushrooms look very similar to magic mushrooms, and it's easy for pickers to mistake them. People have fallen severely sick or even died from eating a poisonous mushroom. Mushrooms drug containing psilocybin are available dried or fresh and have long, slender stems topped by caps with dark gills on the underside. Fresh mushrooms drug has white or whitish-gray stems. The caps are dark brown around the edges and light brown or white in the center. Dried mushrooms drug are typically rusty brown with isolated areas of off-white. Magic mushrooms can taste very different depending on the mushroom species and other variables. Furthermore, what they taste like to one person can often be different than how someone else perceives their taste. Some report that mushrooms drug have a characteristic earthy, woody, or musty, damp flavor that is usually present but may occasionally be complemented by almond, coconut, vanilla, and violet notes. Others find them almost tasteless. How do people take it? Psilocybin mushrooms drugs are ingested orally. They may also be brewed as tea or added to other foods to mask their bitter flavor. Magic mushrooms should be consumed with caution because the positive or negative effect on the user can be profound and uncontrolled and long-lasting. People tripping on psilocybin can experience paranoia or a complete loss of subjective self-identity, known as ego dissolution. Mushrooms drugs effects. If a person is abusing magic mushrooms, they will likely experience some side effects. The side effects of magic mushroom abuse often include enhanced senses, feelings of floating, euphoria, visual and auditory hallucinations, reduced inhibitions, altered perceptions of time and reality, feeling mentally enlightened, distorted sights, sounds, or images, mood swings. Many individuals abuse magic mushrooms for euphoric feelings, trippy hallucinations, and enhanced perceptions. But there are also many negative side effects of magic mushroom abuse. These may include nausea, increased heart rate, psychosis, increased blood pressure, anxiety, chills, paranoia, insomnia, excessive sweating, weakness, lack of coordination, muscle spasms, numbness, dry mouth. When used in very high dosages, magic mushrooms may also cause depression, panic, suicidal thoughts, hallucinogen persisting perception disorder, HPPD, flashbacks, overdose. Are mushrooms drug addictive? There is no clear answer as to whether a mushroom drug is addictive or not because there's no research that shows the mushroom drug is physically addictive, like heroin or some other illicit drugs. Although there has been some debate over this issue. After using psilocybin mushrooms consistently for a few days, some users may not feel addicted while others may begin to crave more of it. Psilocybin mushrooms are often mixed with other hallucinogens like LSD. For this reason, users are more likely to develop a psychological dependence on mushrooms drug rather than a physical dependence. The severity of psychological dependence usually depends on the frequency of use and amount of mushrooms someone consumed. Someone abusing mushrooms drug can become dependent by believing that they need the drug to maintain a sense of enlightenment or happiness. Although psilocybin mushrooms may not be considered habit-forming or addictive, they may cause psychological addiction. Some users may also experience a period of psychological withdrawal after using mushrooms drug, during which they may have trouble determining what is real and what is not. If a person has combined mushrooms drug with other substances like benzos, alcohol, stimulants, or opioids, a medically assisted detox is needed for recovery. Medically assisted detox would help the person using multiple drugs stop further abuse and addiction to other substances before they worsen. In addition, detox would include cutting-edge medication to clean the body of harmful substances with polydrug use. We Level Up New Jersey is offering exceptional evidence-based recovery treatment programs. The combinations of therapies applied for each client are tailored to their individualized needs in treating drug dependency and addiction. We provide cutting-edge full-service rehabilitation care, including residential inpatient, medically assisted detox for drugs, alcohol addiction, and co-occurring mental health therapy. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.